Well, thank you, Gary. I've heard a common theme as a lot of people have come up, and it's recognizing co-authors. And I have to say the same thing. Gary mentioned that it's on the NRC and the DPP. I'm telling you, there's not much time for anything else. So any number you see up here about a pig from the UK, I never touched a single pig on this study. It's Jim Montague handled almost all of the design of things. Without Jim, both Gary and I would be hurting. It's great to have somebody at the farm overseeing things that knows what they're doing. And Dr. Zhang has analyzed a lot of things, did the slides for this. It's great to have a team of people that you can rely on, and that's been very good. There's even more cooperation beyond that. I like agriculture. We're a small group, really. Most of us know each other or know somebody who knows the other person. Well, a lot of this work that we're going to be talking about today looks at some vitamin products from Stewart Products. Rob Stewart is a graduate of the University of Kentucky, and I always see him at the University of Kentucky breakfast at the national meetings. So things just kind of build, and eventually you end up working together and doing things together. And so I like the relationships that are in the area of swine nutrition, swine production, and I'm glad I work in it. So let's go ahead with this. 2 things to push. This ought to be great. Okay. Why are we concerned about vitamin D? It's been in the news for a couple years, a lot of different issues. We'll see a chart in a little bit, some work from Iowa State Diagnostic Labs about the incidence of metabolic bone disease. A thought that there's a low status of vitamin D at birth, and I say low because, what's low, what's high? It's a number on a page compared to some other number in another book. You say, wow, this is less than what people think we ought to have. Well, where'd those numbers come from? We don't have the mortality problem that the industry has struggled with at UK. Yet the numbers you'll see on some of our pigs at birth are small numbers. But so we've got these small, low status numbers. We don't have the mortality problem. So the problem that the industry's been facing is a multifactorial problem. Maybe vitamin D is involved, but it's not just the vitamin D level. And then the issue of low vitamin D of pigs in confinement housing. Well, that sounds good too. Pigs don't have access to sunshine. Well, they haven't had access to sunshine for decades, and we haven't had some of the problems that we're struggling with as an industry now. So it's not just that they're in confinement and don't get the same vitamin D levels. But there is some concern. And when you have calcium phosphorus problems as a result of vitamin D or just calcium phosphorus problems, here's indication of that, beating on the ribs where there's been some breakages and rehealing. So we've seen a lot of those things if you go back to old calcium and phosphorus research. Here's a case, a slide from the Iowa State Veterinary Diagnostic Labs looking at what they call bone disease problems over the last decade. And so seem to be higher now. And I don't dispute that, but I have questions in who's categorizing things, who's sending things in, and so we're the same samples sent in here as here, but now we're seeing more of this. I just don't know. But they're numbers, and they say we may have an issue with bones, so I don't disagree with that. If you have an issue with bones, you're going to be thinking calcium, phosphorus, and vitamin D. So now there's also the peri-weaning failure to thrive syndrome. Pigs that look very good at weaning, robust, 3-4 days later, they start going downhill, very gant, they're not eating, and, it's probably not politically correct to say it, but the best thing is if they die, but usually they don't, and they hang on, and it's just a continuing problem that may exist for weeks. So all of these. And there's been work from Kansas that has shown some of these pigs in this situation do respond to additional vitamin D. So vitamin D may have value, but is it that they are vitamin D deficient? Even when we talk about low versus high versus normal numbers, you talk about deficient versus sufficient in relationship to what? Deficient for what? Is it deficient for maximum bone strength? Is it deficient for some other aspect where D is involved metabolically in the body? And I think it probably is if they're responding. It's not because those pigs don't have failure to thrive syndrome because their bones are a little bit weak. It's a metabolic problem. It's some other type of issue. So, and NutriQuest, some of you get those that newsletter. Chad Hagan said a few months back that some veterinarians have identified low serum vitamin D levels in herds exhibiting signs of that, and have also demonstrated that dosing those pigs with high level of D reduces the severity of the syndrome. So vitamin D can help in that situation, but you're not doing a survey of all the herds because there's probably a lot of other herds that have the same level of vitamin D that would be considered low, and they're not having the failure to thrive syndrome. So, I'm telling you a little bit about where I'm going to be at the end of the talk already here at the beginning. I think vitamin D and increasing it is a great idea. I don't think it's calcium phosphorus related. Okay, a little bit about some of the metabolites. Obviously, we're feeding, if it comes from the skin, so D3 starts out as cholesterol, eventually metabolized to the point that we've got our active hormone in the body. That's cholecalciferol, ergocalciferol in the plant that we metabolize. Goes to the liver first where it's hydroxylated, put on at the 25 carbon. Then we put on the second one at the 1 carbon in the kidney, and then there's also another form that's part of the breakdown of it. Now, again, as far as the 125, the active hormone, the levels are higher in the tissue than in the plasma. For 25-hydroxy, the levels in the tissues are much, much less than in the plasma. The circulating form of 25-hydroxy is what we see in the plasma. A good thing about, why are we measuring 25-hydroxy if 125 is the active hormone? Well, vitamin D3 itself, before hydroxylation, has a 5 to 7 day half-life, 25-hydroxy D3, 20 to 30 days, and this active hormone, 125-dihydroxy, has only 4 to 8 hours of half-life. So the circulating form is the best indicator because of its long half-life. So we have a good idea of that level in the body. Now here's one of those tables that talks about high and low and why we use those terms in the industry. If you look at our farm animals, if you look at the 25-hydroxy of D2, the ergocalciferol coming from the plants, you can see that right here. That's pretty low. This D3 originally starts out from cholesterol, that you see much higher levels. And if you look at these species here, they all have lower levels than what we see in the pig. So an adult pig, about 75. That's much higher than adults of several other species that we work with. And in a young animal, much less than the adult. It's only 13. You see here, now we happen to be below some of these others. So just that change in relationships may suggest that that young pig doesn't have as much as it maybe should have. Don't know. But obviously, if the adult is anywhere from 2 to 5 times higher than other species, then should the young pig be 2 to 5 times higher? Don't know. But they're numbers that have been published. And Ron Horst has done a lot of vitamin D work. This was back in '82, so earlier in his career when he's getting started. But certainly Ron Horst is an excellent resource in the area of vitamin D. As far as vitamin D deficiency, normally when we talk about that, we'll be talking about the bone problems because you can see them easily. If you talk about the relationship of vitamin D and immunology, anybody who's done immunology work, and even Jim just talked about that, boy, you can pick the wrong indicator, whether you're looking at something related to innate versus immune, and then you've got a dozen interleukins that you could look at and how many cytokines. And, if you happen to pick the right one, you say, got it. But a lot of times you pick the wrong one, and you don't know you picked the wrong one until 10 years later, and you say, shoot, I wish I'd done that other one. Then I'd been the first one to show this, but that's research. But you can see if you get vitamin D low enough, bone disease. And the ones we talk about is rickets. So in the young animal, failure for adequate bone mineralization, and you see this here, relatively old picture, but the bowing of the leg. Osteomalacia and osteoporosis in adult animals. The demineralization in both cases, but in osteoporosis, more of a brittleness because you do maintain that mass. You get a softening, or the malacia, the softening of the bone in osteomalacia. So a problem that we have. Now, recently, and I just talked to somebody at the break, The NRC 2012 did increase vitamin D level in the case of reproducing sows. A few years ago, I and Dr. Bubgyun Kim did a paper where we looked at all vitamin and mineral from 1944, the first NRC. We just cataloged them all the way up to the 98 and to look at change over time. And you can see for the starting and growing pigs, those numbers haven't changed in 60 years. So either we're missing a lot of things as nutritionists or else these are pretty good numbers for our normal production. The sows started out at 100 in 1944. Eventually, where it's doubled in 64, pretty much stayed in the same range, and now it's at 800 is where we set that. Again, reference ranges. This comes from a more recent publication. And looking here, here's what a lot of people will be keying on for these newborn pigs. You'll see numbers in this range as we look at some things today. But these are the numbers that a lot of people are looking at when they're saying pigs are low or adequate or high. They come from this paper. And a lot of these are just observational. They're not tests that have been done specifically designed to determine when a deficiency occurs. They've just been observations of animals that seem to be in normal health or whatever. You see one of those here, the inside versus out, or June versus January inside. And then you go to outdoor. But a lower vitamin D in pigs housed indoor compared to outdoors. So sunshine is a great thing. Now this again, low at birth, only 20% of adult values. So adult, quite a range there. So is this an issue? Can we increase it? So that's what we did in this study. I would call all of this a pilot study as we worked with several products from Stewart Products. We're just seeing if we can modify the vitamin D level. We're not challenging the pig with any disease. We've not done any surveys on the farms. We've just gone into the UK system and said we've got a variety of things we could use that might be available to the industry. If vitamin D is deemed to be a problem on a farm, do these alter the vitamin D level in the serum? And so that's what we'll be looking at. For sows, we can supplement in the diet. So we just mentioned the NRC has raised the level recommended for sows, or not recommended, the requirement estimate for sows. We could inject sows. That's two ways. For piglets, I guess we could do oral gavage in the sows too, but I'm going to have to get some new grad students before we do that. But for piglets, we have issues of placental transfer that may be at work here in the level that we're seeing in these pigs, and we can do oral gavage or injection of those piglets at a variety of time points. This is work out of Kansas State that was reported at the Midwest meetings, and they looked at control, just given a carrier, day 1 or 2 after farrowing, so very early in life, or 40 or 80,000 dollars, 40 or 80,000 international units in that same peanut oil carrier. And you can see that at day 0, they're all below that lower level of 5 that was listed in that requirement estimate. You inject, or excuse me, you gavage this at day 1 or 2, and at day 10, yes, they're going up. 57 or 68 international units or nanograms per mil. 57 or 68 when we gave this level at day 1 or 2. Now we're looking at day 10. Now a point here though is even these pigs that were not given any vitamin D, their levels are going up. So they're getting something from that sow. And we'll say milk is a poor source of vitamin D, but it's not devoid of it, because these pigs are raising the level. And then you think about the weight of that pig. The weight of the pig, the mass is increasing, total blood volume is increasing, and yet the level's going up. So that's saying the milk does supply something. So it goes up. Now by day 20 at weaning, it's starting to come down again. So the problem with our work at Kentucky that we'll show you, the problem with this work, it's all good. But when you administer something at day 1 or 2, you don't know where the peak is if you're just measuring at day 10. That peak may be at day 3, 4, 5. At what point, how high did it go? Did it peak earlier and coming down, or is this the peak and now it's starting to decline? But anyway, you see a little bit of the dynamics. And at day 30, 10 days after weaning, We're starting to see an increase again in these pigs that are controlled, so they're getting something out of the feed. And the levels of these continue to come down. So we're having a decline in there. And I don't know if it's this study, Kansas State's done a couple different studies. One of those, they saw a nice growth response in those pigs also. That really got a lot of interest. That's not been substantiated with further studies. This is now work, again reported this year, from the University of Wisconsin, their group. What they did is a control not dosed with vitamin D, or 40,000. And they're just noting for you here the level of vitamin D that the sows were fed, an important factor. You'll see when we come to the UK work, our normal UK vitamin premix is about 800 to 880, somewhere in there. So about half of what they're doing at Wisconsin normally. And what you see then, I believe this is Weaning again. There it is, at Weaning. They are increasing it. So by oral gavage, you can increase it. K-State work shows it. Wisconsin work shows it. Some of the industry work from the vet clinics in Kansas would show it. So 25-hydroxy in the serum was increased by D3 highly significantly. They went beyond and measured some bones. No effect on bone mineral content or density or the ash content of the 10th ribs. So, yes, we can increase the vitamin D in the serum. It didn't impact calcium and phosphorus status as measured by this indicators in bones. So you're not going to force more into the bone necessarily. Relationship of vitamin D between sows and piglets. If you increase the level in the sows, you do increase the level in the piglets. So that makes sense. That's work by Jesse Goff back in the mid-'80s also. So I'm seeing that time pass. So we're going to get to our pigs. We did some studies where we either injected or used oral gavage. So not a lot of pigs, pilot studies, but I think we can see some patterns here that we can be thinking a little further. In this 4-treatment study, we only had 8 pigs per treatment there also. Control with no administration, or we gave an oral administration of 3 vitamins, 3 fat-soluble vitamins. So yes, we know there's confounding here and all that, and we are interested in vitamin D, but we're looking at the whole fat-soluble vitamin issue. We also injected those 3 vitamins, and then we compared them to the product that was used at Kansas State and the University of Wisconsin. Here we see our D3 level is 880 units per kilogram of diet. That's baseline of what we're feeding our sows. Injectable products in the neck muscle. Oral administration, you see a picture of that there, of how we administered that to the pigs. I told you what it was before about the complex, but we're using 40,000 like Kansas State and Wisconsin did. So to get 40,000 of D, we use 0.8 mil of that. And yes, it's getting A and E. And an intramuscular injection, and again, 40,000 of this particular product. 0.8 mils times 50,000. We'll just get into it. All right, 25-hydroxy. You see the sows, their value is increasing. That's just from the feed. So 880, we are seeing an increase in the sows from birth to weaning. We have an increase in lactation feed intake compared to gestation, and we are seeing that vitamin in the serum. These control pigs got nothing. Just like that work from one of the previous studies, their value is increasing. They have been treated with nothing. So yes, it might be low, but it's increasing. Then it decreases to weaning. So, and the same, now let's look at the product that Kansas State and Wisconsin did. Bumps it up to 60 units, nanograms per mil. If we do the injectable product, it's higher, statistically higher. And in this particular study, we got a low number of pigs. I'm going to show you a bad value that does not repeat the next time. It's changed. Strange here on when we put vitamin D, same level as here, but we put it orally in. At day 10, we're not as high, significantly different. That raised questions in our mind. Well, is putting A and E in there, having a negative effect on D absorption. And we'll see in the next study it didn't happen. Because of time, I'm not going to spend any time on this. The numbers are in your paper. This is a vitamin D. But we do give you the retinol and alpha tocopherol levels that we observed also in this study. So you can see what's happening there. This is just to show it graphically rather than in a table. Now let's look at growth performance. Kansas State showed an improvement in growth. Just looking right here, you see no superscripts. There are no significant differences in growth. And in fact, numerically, 0.23 on our controls, 230 grams per day. On the controls, we run 210 to 240 grams per day on the 3 treatments. So we saw no change in growth. Now the second study, we had 7 treatments this time, a control with no administration. We only used 4 liters of pigs, so limited numbers. We can get some inferences here. We're not going to be submitting this for any kind of Nobel Prize in anywhere. Our control this time was the injectable administration of the vitamin complex. If you inject it into the animal, you know it's there. You may not know on an oral gavage whether it's absorbed, but you inject it and it's in the animal. And then we had 5 different oral administration treatments that you'll see explained on the next slide. We bumped it a little bit from 40 to 50,000, so we got 1 mil times 50,000. So 50,000 is our baseline. We look at the product again that Kansas State and Wisconsin used. 40,000 is its concentration, so we gave 1.25 mils of that. Another Stewart product that's higher concentration, just D. You multiply those 2 numbers, you're going to be right on 50,000. And then we've got a D and E complex. Remember, we'd asked the question, is that using A and E harming the absorption of D? So now we've got to work with some combinations of those to see if, in fact, that did occur. So we've got D and E. We're supplying 50,000 of D and some E with that. Here we're going to give just the E, and then we do the 3-way E, A, and D combination to see if that apparent negative would sustain. Again, a reminder, 880 D3 is what we're feeding at Kentucky. So here we are. At birth, the controls, nothing happened. Again, it increases to day 10. There is value in milk. If we inject, yes, major increase at day 10. The oral D3 that Kansas State used, higher than the first study, 90 nanograms per mil. Just the oral D of just the D, 86. If we put E with the D, 84. No major difference. We put A, D, and E, 77. So it did not have a statistically significant reduction by going to a multivitamin oral gavage. And if we look at weaning, then we see we still got values that are quite high. I'm going to skip that one. If you go to the Minnesota Nutrition Conference next week, you'll see it there. Plus a study where we injected sows. So there's more work out there. Growth performance, looking again, no superscripts there, no statistically difference in growth. Birth to weaning, this time in this group, 200 grams per day. We're running from, well, this is an oddball, 140, I don't believe it. There was one pig that was really bad, and so, but 190 basically to 260 on there. We're not seeing any statistically significant differences. It is a limited number of pigs. I'm going to skip this too. We have looked at water for 2 weeks after weaning. So delivery of D and E in the water. I'll just show you the D work. Okay. Control treatment at birth. Nothing to them. Or we injected with A, D, and E. That was the level that always gave us the highest. If we inject, we get the highest levels. Then for the 2 weeks in the nursery, either without vitamins in the water or with D and E in the water, in both cases. Now we remember, if we don't treat these animals at birth, they have low values, around 5 here. Then if we go into the nursery, we're up to 32 nanograms per mil just from the diet. Now some people say that's higher than they expect. That's what we got. So 32 just from the diet. We put the water treatment in there, we jump it up to 66. So that water is a good delivery mechanism. The injectable, at weaning, we expect a value 30 to 40. It was there. Here's the two groups. We put no water vitamins. It declines a little bit to about 38. We put water vitamins, D and E. In this situation, it goes up to 67. In both cases, it runs up into the 60s. So the amount of change or the increase differs, but it looks like we're in the 60s somewhere. The only thing I want to do with that, show you one more slide. This is all the other treatments that we had. We had those 7 treatments. All I want to do is show you one thing. Day 14 post-weaning, this treatment, what do we get? A value in the 60s. This treatment, what do we get? A value in the 60s. This treatment, what do we get? A value in the 60s. This oral E, it didn't have any D, so that's like controls again, almost in the 60s. Oral A, D, 3, and E, value in the 60s. I think there's homeostatic mechanisms at work. You can't run the number up infinitely higher. All of these treatments end up in the 60s, no matter where they were at weaning, whether they had a relatively low value or relatively high value as a result of an injection at some time during lactation. If you put water in the vitamins in the water, they're going to plateau out in the 60s. So, yeah, maybe we do have an opportunity to raise that D, but and there's a variety of ways you can get there. Injection, in the diet slower, or in the water. The only reason I'm putting these two up, 2 human studies, this one is not even out in paper, but it's been accepted in late July. Vitamin D accelerates resolution of inflammatory responses. There's a typo. During tuberculosis treatment. On the human side, they see faster recovery from tuberculosis if they co-treat with vitamin D supplementation. That's going to be bacterial. Association between serum 25-hydroxy level and upper respiratory tract infection in a national health examination survey. Went back to old data that had been collected, looked at the levels of vitamin D, and then self-reported incidences of upper respiratory tract infections. They note in the paper that you're sneezing, you're coughing, your runny nose, your plug nose. There's about 200 viruses that contribute to the human cold. So here we have an incidence where there's statistically significant relationship between the level of vitamin D in these people and their incidence of a cold. So whether it's bacterial or viral, we have some human information that says vitamin D is a positive in those situations. So I think we can do a lot with vitamin D. I don't think it's calcium phosphorus related. I think it's something related perhaps to inflammation and the immune system. But we can improve that serum status if a farm thinks it's important. We've got injectable feed and water routes to go. Some vitamins like A and E may compromise the absorption. We had conflicting results. I don't think it really is a big issue. And we may need more vitamin E. I didn't show you that because of time. Vitamin D3 dose to sows before farrowing can improve that. That's the injectable level. And what we didn't look at, but you can probably see in the tables in your text, you look at that magnitude of increase from birth to day 10 from Kentucky work versus the others, where we have 880 in our sow diets, other places have 1,500, some others 2,300, you will see there is a response in those piglets based on what you feed the sow. It's comparing farm to farm, not direct experimentation, but it makes sense. So the vitamin D we are providing for our sows is getting the job done. So anyway, thank you very much. And Gary, I think we probably go to the next speaker, and I'd be glad to answer anybody's questions right after if you want. Go on.